Patient I'll be presenting today is an 8-year-old female with a history of ADHD and ODD. She presents with a complaint of increased anger and agitation, and also having difficulty concentrating at school with increased distraction also. With her mood, again, she's a pretty angry young lady. She's aggressive with her peers. She has very short fuse. She picks on her blind sister. She intentionally frustrates peers in her classroom, and seems to have a lack of insight into her behaviors, often answering questions with "I don't know." With her schoolwork, she's having difficulty paying attention in school. She's having difficulty completing homework at home. It takes a lot longer than it should. For instance, the other night it took her 3.5 hours to do 12 math problems. And then also requires several reminders at school before behavior is redirectable. Anxiety she denies. Objectively, she appears mildly anxious. She denies suicidal ideation, NSSI, and psychosis, and is having no thoughts of harming others. Medication-wise, currently she's on Risperdal 0.5 daily, Vyvanse 40 daily, Dexedrine 15 at lunchtime, Clonidine 0.2 at bedtime, and melatonin 3 at bedtime. Also worth noting is that she's trialed several stimulants, and none of them have seemed to be effective. In other notes, she has a family history of bipolar. She's in custody of her paternal grandparents. She sees her bio mom about once a week, and sees bio dad maybe 1 or 2 times a year. She's in custody of her grandparents related to some drug use in the home, in her parents' home. So she was taken away and given to her to grandparents. There's also fetal exposure to heroin. She went through withdrawal in the first few weeks of her life. Plan-wise, with the medications, we're going to increase the Risperdal from 0.5 once per day to 0.5 twice per day. We're going to increase the Vyvanse from 40 to 50 milligrams daily to see if that has any effect. We're going to continue the Dexedrine as is. Going to continue the Clonidine and melatonin as is. We may consider moving away from the stimulants due to several trials without any real improvement, but we're going to wait a month to see if the increased dose of Vyvanse does anything for her. So again, gonna follow up in 1 month and see if there's any efficacy in medication changes. Thank you.